Welcome to another wonderful episode of Eyecare. Today we are going to be talking to you about hypertension, high blood pressure. We're here at Hazleton Eye Specialists on Airport Beltway 281, Hazel Township, PA. Telephone number here is 570-453-2020. If you haven't seen it already, we have a wonderful big eyeball outside, so you can't miss us. So we're right by the big eyeball on Airport Beltway in Hazel Township. Also, our other beautiful office, brand new office in Tannersville, Pennsylvania, Stroudsburg Eye Specialists. That's at 2943 Route 611, Suite 5, right behind the Friendlies on Route 611 in Tannersville, not too far from the outlets. And in that vein, I have a Tannersville native here with me, our newest member to the team at Hazleton and Stroudsburg Eye Specialists, Dr. Corinne Bellinger. How you doing, Dr. Bellinger?
I'm good.
Where'd you go to college, Dr. Bellinger?
I went to Westchester University.
Westchester University. Fantastic. A really good school. And what did you study there?
I was a biology major.
Biology. What was your most interesting aspect of biology? What did you like to learn about biology?
I love the pathophysiology of the human body.
Okay.
And that is just the function, why the anatomy is the way it is and functions the way it does.
Well, that's
amazing.
We didn't even plan this,
No?
but that was a great introduction into what we're going to be talking about today.
Absolutely.
Which is high blood pressure. And, you know, I told Dr. Bellinger about this taping we were going to do, and she said, "You're making me have high blood pressure." No, that's not true. She's very, very good at this. You know, what is high blood pressure, Dr. Bellinger? What should people know about this? Is this something that people know they have, they don't know they have? What should they know about it?
I think it's more silent than anything, especially probably most people have a more moderate to mild form of it. It probably wouldn't cause more symptoms until you have a very severe case of high blood pressure, which is just a fluid dynamic pressure, and it all has to do with the health of our blood vessels and the way that they're able to constrict and dilate and, you know, help us throughout the day.
So we're eye doctors.
We are.
So why do we care about high blood pressure? Why is this something that we should be talking to patients about? Why are we having a show about it today?
High blood pressure, and well, you know, the eye is an organ that is extremely vascularized, and by that I mean there are a ton of blood vessels in the back of the eye, different levels of blood vessels, and they are all extremely important in the function of the eye, as well as the very important functions of the organs throughout the body. So for us, we look for any changes in these blood vessels over time, because any damage to them can be significant to our sight and our eyes and what we see.
That was a great 50,000 foot view. So let's get into, you know, just how many people this affects. You know, we had another show recently about diabetes. We talked a little bit about how prevalent that is in our patients. What about hypertension? Is this a common condition that we see?
This is extremely common, and I think it probably affects all races, all genders, probably pretty equally. And you know, it's all generally our health, and sometimes we can control it, and sometimes we can't control it. But there are certain people that are at higher risk.
I've heard 1 in 3 patients that come into an office visit are going to have high blood pressure. I've also heard that high blood pressure, and I've seen this and read it, that high blood pressure is one of the most major contributors to cardiovascular disease and death across the country. So while diabetes is a major contributor to stroke, high blood pressure is a major contributor to cardiovascular disease and heart disease. And we're going to jump into kind of why that is here in just a little bit. So what are some of the risk factors for high blood pressures? We talked about, you know, diabetes and risk factors for diabetes. what about risk factors for high blood pressure? So we're seeing a patient and we're looking at the patient. We're of course examining their eyes. What are risk factors for high blood pressure?
They actually are, some of them, coincide with diabetic risk factors, and a couple of them would be age. Obviously, the older you are, the more likely you are to develop high blood pressure. Obesity or being overweight. Smoking's a big one for high blood pressure.
What about vaping?
And the new vaping, yes. I don't know. That might be a whole nother conversation.
That's a whole other show. We're going to come talking about vaping in a little bit. But we're learning that that's not as good either. It's causing a lot of lung problems.
A more sedentary lifestyle, which is something that we're all kind of a little bit more, prone to nowadays with the use of technology and having jobs that require us to sit and focus on a computer. So these types of things lead to lack of exercise, and that's all contributed to being at risk for high blood pressure.
Say family history?
Family history is a big one, yes.
Family history, so mom,
certain
dad,
kidney
uncle.
certain kidney diseases and other types of systemic disease can make you at more risk for high blood pressure, but yeah.
Wonderful. Sodium intake is another one. You eat a lot of sodium, that's something's going to cause you to retain water and potentially have higher blood pressure. So yes, blood pressure is something that we want to look at a person and determine whether or not they have any risk factors. But we have a really neat, easy way to check blood pressure, right? We can't necessarily do that with blood sugar just as easy, but with blood pressure we do, right? So we want to make sure that we're checking patients' blood pressure. So one thing that I think people comment on a lot when they come to our office is how we check people's blood pressure. And it's extremely important to do. So your blood pressure is a measurement of your blood flow in your body, and specifically two different measurements of flow. So you have the top number and the bottom number, and a lot of times patients describe them that way. Well, my top number is usually this, or my bottom number is usually this, or whatever. And so what you have is the systolic blood pressure, that's the top number, and the diastolic blood pressure, which is the bottom number. The systolic blood pressure represents the pressure of your blood when your heart is in systole. That is the contraction of the heart. So that's measuring your cardiac output and the strength of your heart, and how hard the heart is working to push blood out into the first big blood vessel in your body, which is called the aorta. So it's a measurement of blood as the heart goes whoosh and pushes it all out. And then diastole is the lower number. It's a lower pressure because it is measuring the pressure of the blood when the heart is relaxed. So systole is when the heart is contracted, and diastole is when the heart is relaxed. And so you have your systolic blood pressure, which is naturally higher, and your diastolic pressure, which is naturally lower. On the other side of this break, we're going to talk a little bit more about what that means and what good pressures are and bad pressures are, and some of the ramifications with your health in regards to high pressures and low pressures, and what we look for specifically in the eyeball. Thanks for joining us on Eyecare today. We'll be right back. Welcome back, everyone, to Eyecare today. We are here talking about hypertension or high blood pressure, and we're coming to you from our Hazleton eye specialist studio in the waiting area of our location here on Airport Beltway, 281 Airport Beltway, Hazel Township, PA, 18201, by the Big Eyeball out in the front on Airport Beltway. Telephone number here is 570-421-3342, and also our beautiful new location in Tannersville, Pennsylvania. Just a fantastic selection of frames, and a beautiful location with Dr. Bellinger, Dr. Olzinski there most of the time, and great facility with lots of availability. So give them a call, 570-421-3342 for an eye exam today. So we're here today with Dr. Belanger. Dr. Bellinger, how are you?
I'm good.
We're talking about...
This is a great segment. I love this.
Wonderful. It was your idea, so I hope you like it. This is all about high blood pressure. And so we were just talking about exactly what the top number means and the lower number means, because I think a lot of times patients don't know that. A lot of healthcare professionals don't know that. So we went over that. And so what's good, what's not good? I want patients to understand that. And I think generally speaking, people know that what is good. The two numbers that a lot of people know.
120 over 80.
There you go. 120 over 80. That's good. That's perfect. That's what I need. And so what's important to understand is that there is sort of a range. You know, there's an important range that occurs. There's also some things that happen in a doctor's office that maybe don't happen elsewhere, and that maybe happen when you're sleeping, that don't happen when you're awake. And so blood pressure can do different things at different times of the day. So what's a common thing that we see when we take people's blood pressure in the office here? What kind of response?
Well, they have white coat syndrome.
White coat syndrome. Well, what is that?
That is just the anxiety of having your blood pressure taken so it automatically goes up.
Right. So it's not accurate.
It is not accurate.
So, you know, we want to, and we do, and other doctors, primary care doctors, nephrologists, and doctors that take care of high blood pressure want to make sure that when they're testing somebody's blood pressure, it's accurate. So usually, like us with glaucoma, a condition that is characterized by high eye pressure, not associated with high blood pressure, but similar in that we want to get multiple readings to determine if it's accurate. So we will typically, before somebody is diagnosed and treated for high blood pressure, have 3 separate blood pressure measurements. And then if those blood pressure measurements seem to be accurately high, treatment may be started, or diet and exercise regimen might be started. But numbers that patients should probably know are from 120 and lower is good. 120 to 130 is pre-hypertension. And 30 to 40 is hypertension stage 1. 40 and above, 140 and above, is hypertension stage 2. 140 and above is sort of, I think, the number that patients should know. Hypertension really starts there. And 90 and above, for the diastolic number, is another number that I think patients should know. So 90 and above, 140 and above, those are numbers you should know, as that's starting to represent a significant increase in risk, again, for other things like stroke, okay? So from that perspective, what are some things that patients can do if they are recognizing that their blood pressure is elevated? Because I think this is something that patients should do, is, you know, especially if they do present with some of those risk factors that we discussed, family history, a sedentary lifestyle, or obesity, they should be checking their blood pressure. Check it at a local pharmacy if they have a blood pressure cuff there, and find out what their measurements are. What are some things that we could do early on to maybe help with that?
Yeah, exercise is extremely important, because that is, I think of any type of cardiovascular, or what we consider cardio exercise, that is going to be a great workout for your blood vessels. That's right. That is the blood vessel workout. So that is just helping and strengthening the blood vessel walls and the ability to maintain a good blood pressure. So diet and exercise. Diet would be a low sodium diet, the DASH diet.
Oh, that's right.
And that helps us to retain less fluid volume, therefore reducing the fluid pressure in the body. And generally overall eating, you know, better fruits and vegetables, what we call the outside of the grocery store, the outside aisles. Those are the important things.
Oh, I didn't actually know that. Okay, cool.
You know, shop around the outside of the grocery store.
Don't go to the Cheetos. No offense to Cheetos.
I mean, don't go to the Cheetos aisles per se.
Yeah,
if you're trying to help lower your own blood pressure, you know, naturally, those can be very important things. Fruits, vegetables, lean meats, and low sodium.
Perfect. You know, I think a lot of people don't understand what's really going on. Why does pressure matter? Well, there's a damage that occurs at blood vessel walls. We talked about the damage with diabetes. The damage that occurs at the blood vessel walls in high blood pressure is that this constant force that's not regular, it's not on purpose, does not match what the heart can do, and so you get a hardening of the blood vessel walls. Atherosclerosis can occur, and so then we get weakening of the blood vessel walls. There can be outpouchings of the blood vessel walls, or an aneurysm can form, and ultimately we get stroke, or the heart is unable to keep up with the fact that it needs to push the blood harder to get through these harder blood vessels, and we get a heart attack, or the heart's really pushing. It's making more muscle, and that muscle doesn't have accurate blood flow through the coronary arteries, and those muscles there aren't able to continue to work, and that's what we call myocardial infarction. So on the other side of this break, we're going to talk finally about the eye. I know you've been waiting on the edge of your seat to hear about what hypertension does to the eye. We'll be right back. Welcome back, everybody, for the final segment of our high blood pressure or hypertension discussion. I'm here with Dr. Corinne Bellinger, our newest addition to the Hazleton Eye Specialist, Stroudsburg Eye Specialist crew. Very excited to have her joining our discussion today about hypertension. We are, of course, at our Hazleton Eye Specialists studio on the Airport Beltway, right next to the big eyeball on the Airport Beltway, 281 Airport Road, Hazel Township, PA, 18201. That's 570-453-2020. Give us a call. And then, of course, we have our beautiful brand new office in Tannersville, Pennsylvania, right on Route 611. You can't miss it. Very easy to get to, right behind Friendly's on Route 611. Not more than a mile down the road from Tannersville outlet. So you go shop, get some stuff for your family at the outlets, and go get a great eye exam at our Tannersville office, Stroudsburg Eye Specialist. That's 2943 Route 611, Suite 5, Tannersville, PA. And the telephone number there is 570-421-3342. Check us out on the web. We have a fantastic website, loads of information and videos on our website at www.drkislin.com. So we are here talking about hypertension. And we've talked about how important hypertension is to be diagnosed early, how many folks have hypertension, don't know they have it, and some of the things we can do to avoid the risk of developing hypertension or even treating it in the early stages. Now I'd like to talk about how we play a role in hypertension. So I'd like to hear from your perspective, what are some of the most common things you see in patients' eyes as it relates to hypertension?
You know, there's always been talk about the eyes being the window to the soul or even the health of the eyes, and it's so true. We as healthcare providers and eye care providers are able to see blood vessels in their active form without cutting you open, without any, really not that much technology is involved in it, and we can zoom in to the back of the eye and the retina and literally see blood pumping through your blood vessels. And this tells a ton about the health of not only the eyes but the body. This is really important, and this is why primary care doctors are always pushing you to go to the eye doctor, because they know that we can see things they can't.
Absolutely. Yeah.
So things that we look for is specifically changes in the curvature or the structure of the blood vessels in the back of the eye.
I think we have a picture of that right now. So what do we see here?
The blood vessels in the back of the eye of someone that is hypertensive or someone that has high blood pressure usually begin to get a curvature to them, and they get curvy. They're supposed to be straighter, and we see that the blood vessels actually become curvy, and that is the thickening of the blood vessel wall, because the pressure has been elevated to a certain extent for a number of time. So that's usually one of the things we start to see, and this is when we start to educate the patient on the importance of checking your blood pressure, making sure that your primary care doctor has it under the best control, making sure you're on the correct medication for it, so that we don't see even more curvature. And I think that one of the awesome things about the technology that we have here is that we can monitor so closely from year to year or even months to months to see if your blood pressure is causing any damage to your blood vessels. And the blood vessels in the back of the eye are very similar in size to those of the kidneys. So the things and the changes that we see in the back of the eye are happening in your other very important organs like your kidneys. So it's a great conversation to have, and it's a great technology to be able to to watch this year to year, and we can demonstrate it to you, you would be able to see, you know, the size, shape, and changes of your own blood vessels. So I think that's a great, obviously a great education tool, and you know, really important for your health. So there are other things that we can see from high blood pressure in the back of the eye. We can see strokes in the eye. Wow. Where we have either a stroke where the vein it has a stroke, or the vein is occluded, or an artery is occluded, and very, very common for these things in the back of the eye. You can lose your vision from it. Wow. So this is very important, and these obviously happen over time, an extended period of time where your blood pressure is out of control, and that's why it's important to, you know, have routine checkups with your primary care doctor, have routine checkups with your eye doctor. Extremely important for us to monitor change over time and to make sure that we have the appropriate management of these diseases.
One other, I think, very interesting thing, something that, you know, we see quite often, is a change in the blood vessel flow to the muscles of the eye. One thing that people forget about is that you have muscles attached to your eyeball. So we care about your eyeball, and we talk so much about the retina. We have more to even say about the retina and the optic nerve. But one thing that I think a lot of people don't know of is that you have 6 eye muscles controlling the movement of each of your eyes to be able to see singly and clearly, so that you can see one thing out in the distance. And so one of the most common reasons for double vision is high blood pressure. And one of the most common reasons for that is a change in blood flow to a muscle that controls the movement of your eye out and in. And so there can be a loss or stroke, if you will, of flow to that muscle. And that is one of the most common things that we'll see as a reason why people get double vision in older ages. So, you know, somebody might come into the office and their eyes turned in or out. Usually somebody over the age of 65. This is very uncommon for someone under that age. But if they come in, their eyes turned in or out, then we're going to immediately want to work them up for, you know, an impending stroke. And this is a sign of oftentimes relationship to years of high blood pressure that's gone unchecked. So that would be something else that we could look for. You mentioned the changes in the shape of the blood vessels. Sometimes that can change so much that they could break, right? And so we could see bleeding in the back of the eye. And then the end stage of really bad high blood pressure is a special type of blood pressure. What's that called? Is it malignant?
Malignant hypertension.
Right. You were talking to me about that before, and one of the things that you had mentioned was that the optic nerve, right, can get a certain appearance. What happens to the optic nerve in malignant hypertension?
The optic nerve can become atrophied, so we see changes in the color of the optic nerve. Normally our optic nerve is supposed to be nice and pink, and that shows us that it's getting great blood flow and great blood supply, and in the malignant hypertension cases for the optic atrophy, it's basically we see a white appearance because it's lack of blood flow to that nerve.
Right. So, you know, the thing that, you know, I often tell patients is that the optic nerve, the retina, those things are like your brain. They are your brain. It's the same tissue. And so when damage happens there, we're going to work very hard to get it back, but it's easier to never lose it. And so it's easier to have this conversation when you're 40 and we're talking about the DASH diet, and we're talking about exercising, we're talking about getting your primary care doctor, living a healthy lifestyle, making good choices, quit smoking, stop vaping, all that good stuff. But if we have to deal with it later, we will. And certainly we'll try to avoid damage. So, you know, if you're out there and you're concerned that you have high blood pressure and you're not sure if it's affecting the back of your eye or how you're seeing, and you would like a really thorough eye exam, give us a call. Hazleton Eye Specialists, 570-453-2020, or Stroudsburg Eye Specialists, 570-421-3342. Check us out on the web, www.drkislin.com. Thank you, Dr. Bellinger, for joining me today. This was a fantastic conversation, and we look forward to seeing you in the office.